I'm Professor Irshad Shaikh. I'm one of the general and colorectal consultant surgeons at Norfolk in Norwich University Hospital. I joined this trust in 2014, and this is where I perform my primary NHS practice, but I also undertake private practice at the Spire Hospital Norwich and Spire Hospital Cambridge. Along with that, my significant other role includes teaching robotic surgery across the UK and Europe. So primarily in the UK, I visit various different hospitals to teach robotic surgery to consultants and trainees and undertake several robotic courses. MBBS, I worked in various different surgical specialties, particularly attracted by the general surgical specialty because general surgical specialty gives you exposure to variety of conditions where I'm able to help patients and keep my skills going. And then I further chose colorectal surgery as a subspecialty since I moved to UK and I trained in colorectal surgery. And in colorectal surgery, my special interest includes colorectal cancers, advanced colorectal surgery, which includes pelvic exenterations, and I also undertake coloproctology. So amongst the colorectal cancer specialty, I have got special interest in robotic surgery. I'm one of those surgeons who pioneered robotic surgery since 2017. After 3 to 4 years of practice using robotic platform, I was promoted as a robotic trainer. Since then, I've helped several different units in the UK and Europe setting up robotic surgery as a national trainer. Along with that, on a private side, I undertake significant amount of work in coloproctology, which includes hemorrhoids, piles, anal conditions such as fissure, anorectal pain, discomfort, rectal prolapse surgery, for example. And I also undertake a significant amount of my general surgical work on the private side, which includes all sorts of hernia surgery. Now, since this year, beginning of this year, I've started performing hernia surgery robotically as well. But this happens currently in Cambridge, but I hope to perform these operations robotically in Norwich as well. So when patients are referred to me, they come through primarily 3 different routes: a direct GP referral, and second one is recommendation from insurance, and thirdly from cross-specialty referrals. Of course, it depends on the patient conditions. Either it's a simple condition or a complex situation. So I give highest priority to patient confidentiality and shared decision making. So which means that in a clinic discussion, we will have a informed discussion on their health condition, and if there are different type of treatment choice available, we discuss the treatment choice and we make the shared decisions. Of course, patients have got complete autonomy and right to go home and further discuss with their family members, and if they want to change their decision, for example, or if they want to have further clarification, they're more than welcome to contact me. And whatever we talk, we create a summary information, and that will be given to the patients and their respective GPs as well. If I have to perform an operations, there will be a proper process of informed consent process, and I'll provide them written consent to take home and understand and read. And there will be a dedicated pre-operative assessment, and just immediately before the operation, there will be a possibility to ask further questions, and then we'll have a post-operative discussions and follow-up as well. And I would like to reassure all patients that if there are some conditions I may not know in detail, or for example, or I may not perform those operations, in that situation, I will make every effort to refer them to appropriate specialties, for example, or even a different surgeon who may have got more experience in that particular condition, and then so that ultimately the patient should benefit from the respective specialty and the skills available in the both NHS or private sector.